Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about heart attack with board-certified interventional cardiologist, Dr. Elias Skaf. Okay, Dr. Skaf, we have our patient and they're coming to the emergency room. What happens next?
Okay. Now, once the patient is on his way to the emergency room, Barb, of course, the EMS called the ER doctor at that hospital. So the emergency room is aware that patients with heart attack is on the way. And by doing this, we activated the heart team, and that include the cardiology on call as well as the cath lab staff on call. Now, once the patient arrives at the emergency room, he will be assessed by the ER doctor. The EKG will be reviewed again and maybe doing another EKG in the ER as well. Now, they will prep the patient to go to the cath lab as soon as possible. Now, I want to point one important thing. This process has to go very, very fast and very quick, because we have to keep in our mind that the muscle of the heart is not getting oxygen and blood flow, and the muscle is dying. So we have to move very quickly, try to see what's going on and open the artery. Of course, beside that, the patient in the ER will be assessed by the ER doctor, who will check the blood pressure, check the heart rate, make sure the patient hemodynamically is stable or unstable as well. And as I mentioned earlier, the patient will be prepped to undergo a heart catheterization as soon as possible.
So family or anyone that might be with them and the patient can expect everything to be happening at once to them.
Exactly. And this is going to be, I want to point one thing, we talk about it in taking care of patients with heart attack. Time is muscle. So we like to find out what's going on, and we like to open these blockages in the occluded artery as soon as possible. And studies have shown that the earlier we do it, the better. And also studies have shown that if we open this artery in a time less than 90 minutes, where the patient hit the emergency room, that will give us the best outcome for the patient.
Okay, so everyone is working toward that time goal of getting that patient to the cath lab.
Absolutely. Here in our hospital, when the patient arrives by EMS to the ER, the cardiologist as well as the cath lab staff will be there waiting for the patient. So will assess the patient, because they are activated, or they were activated actually before the patients arrived to the emergency room. So everybody is aware that we have a patient with heart attack is on the way to the hospital, and everybody is ready. The cath lab is ready, the cardiologist is ready. They meet the patient in the hospital, take the patient right away to the cath lab.
Can you tell me about the procedure in the cath lab then, the angioplasty?
Definitely. So we do what we call it an emergent heart catheterization. After the patient was seen and prepped in the emergency room and taken to the cardiac cath lab, we do what we call it an emergent heart catheterization. We go from the leg or from the arm to the heart. So we insert a catheter. I can point here actually. We insert, this is where we do the procedure from the leg. We insert the catheter, go all the way up to in the aorta to the heart, where we inject dye, and that will tell us exactly which artery is blocked. And the next step will be, is once we found the blockages, is by opening this artery by stent and balloon. That's what we do. And this is where, I just want to point, this is how the stent looks like inside the artery after we open the artery up.
Can you do more than one artery at a time?
Yes, absolutely. We can do more than, if we need to, we can do more than one artery at one time. All that determined by the patient clinical status. If the patient continues to have chest discomfort after we open the blocked artery, and we know there is another blocked artery, we can go after the second one. Or if the patient hemodynamically continues to be unstable after we open one, we definitely can go after the second one.
How do you know, or how soon do you know if the procedure's been successful?
Well, Barb, believe it or not, the chest discomfort were resolved immediately after we open the blockages. Plus the patient's blood pressure and heart rate will improve. This is all indicators that we're moving in the right direction. We open what we call it the culprit artery, responsible for the heart attack at that point. that happened immediately, right away. Now, I want to point one more thing, Barb, that we do heart catheterization. We know what's going on. We know about the anatomy. Where are the blockages? How many blockages? At certain time where we cannot do balloon and stent, the patient will be referred to have an open heart surgery immediately, or what we call it emergent coronary artery bypass grafting. So what I'm trying to say is not every patient with heart attack will be treated by balloon and stent. Sometimes we have to send the patient to have an emergent open heart or emergent coronary artery bypass grafting, and this is just because of the anatomy really or the anatomy of the patient at that time, or the blockages, they don't work good for stent and balloon.
And you're still working under that whole time is muscle thing.
Absolutely.
So
that's why I said we said like emergent CABG, where again the OR team will be called immediately to come and take care of the patient.
Excellent information. Do you have any closing comments for our viewers?
I do, Barb. I wanna just say a few points. Number one, chest discomfort is the most common symptom of patients with heart attack. But again, we have to look for other symptoms. And as I mentioned earlier, neck discomfort, right or left arm discomfort, back discomfort. Sometimes the patient doesn't have discomfort at all. So they feel just weak, tired, fatigued, has no energy. These are very important symptoms as well. Again, taking care of the risk factors for heart attack is a major issue. Lowering the sugar, lowering the blood pressure, lowering the cholesterol, exercise on a regular basis, take care of the diet, and have a good diet. These are very important. And most importantly, smoking cessation. That's the most important thing. And again, if patients feel that they are having a heart attack, please don't drive yourself or let anybody else drive you to the hospital. Please call 911, take aspirin, sit tight till the EMS arrives and take care of you.
Thank you so much for joining us today.
You're welcome, Barb.
We'll be right back.